Okay, take a look at your hands. I mean, really look at them for a second. It turns out your fingertips might be holding a fascinating piece of medical detective work, a clue that doctors have known about since the time of Hippocrates. So yeah, let's dive into what's going on here. We're going to kick things off with a simple test. A little trick you can do right now wherever you are. It's a physical sign that can sometimes act as this silent alarm for what might be happening inside your body. So, what's the big secret? What on earth could our fingertips possibly be trying to tell us about our overall health? Well, let's find out. Okay, this is called the Shamroff sign, and you can do it right now. Go on, try it. Take the same finger from each hand, let's say your index fingers, and press the tops of them together, nail to nail. See that little diamond-shaped gap of light that appears right between your cuticles? That little window? That's exactly what you want to see. That's normal. But what if that diamond just isn't there? When that little window disappears and the nails press flat against each other, that's what doctors call a positive Shamroth sign, and it's a classic indicator of a condition known as nail clubbing. So what is nail clubbing? I know, it sounds a little weird, right? But it's a very specific physical change that doctors are trained to spot. Let's break down what's actually happening. So officially, nail clubbing is when the soft tissue at the very end of your finger, that last little segment, starts to swell up. This swelling actually changes the whole shape of your fingertip, and specifically, it messes with the angle where your nail grows out of the skin. And this slide shows you exactly what to look for. It's all about something called the Lovibond angle. You can see on the left, a normal nail has this nice clear angle. It's less than 180 degrees. But with a clubbed nail, look at the right, that angle basically disappears. It flattens out to more than 180 degrees, and the nail starts to curve down, kind of like the back of a spoon. Okay, so your fingertips get a bit puffy. Why should you care? Well, this is where it gets really important. The clubbing itself isn't what's harmful, but it can be a huge signpost pointing to something much more serious happening inside your body. Just how serious? Well, get this. For patients in the hospital who are found to have clubbing, the research shows that in about 40% of cases, it's linked to significant underlying disease. That's a huge number. And when the cause is a cancer in the chest area, the numbers are pretty staggering. Lung cancer is the #1 culprit by a long shot, responsible for a whopping 80% of these cases. Now, that doesn't mean everyone with lung cancer gets clubbing, but it's a sign that makes doctors pay very close attention. But, and this is a huge but, it's absolutely not just about cancer. The list of things that can cause clubbing is incredibly long. It can be from other lung diseases, heart conditions, even gastrointestinal issues like inflammatory bowel disease. And sometimes it's completely harmless. It can run in families, or it can happen for no known reason at all. The key takeaway? It's a clue, not a diagnosis. So that just leaves one big question, right? How? How on earth does a problem in your lungs or your heart cause your fingertips to swell up? Let's get into the leading theory, because it's actually pretty fascinating. At its very core, the physical change is all about blood vessels. The main thing scientists find when they look at clubbed fingers under a microscope is a big increase in the number of tiny little blood vessels, or capillaries, packed into the fingertip. So, how does that happen? Well, the leading idea is called the platelet hypothesis. It goes like this. Normally, big chunks of platelets get filtered out and broken down in our lungs. But if a disease creates a sort of bypass, these big platelets slip through. They travel all the way to the tiny capillaries in your fingertips, and they get stuck. Once they're trapped, they release these potent growth factors, chemicals that basically act like fertilizer, telling the surrounding tissue to grow and to build more blood vessels. It's this wild chain reaction that ends with a change you can see with your own eyes. Okay, so let's say a doctor spots this. What happens next? What's the game plan? Well, this is where the real medical detective work truly begins. It's a very logical, step-by-step process. You start with the basics, a really detailed conversation about the patient's health history and a full physical exam. Then, since we know lung and heart stuff are big culprits, a chest x-ray is usually next up to check for anything obvious. And if that comes back clear, but the doctor still has a strong suspicion something is up, a more detailed CT scan can give them a much closer look. And all of this work, all of this investigation, it's all leading to one single ultimate goal. And it has nothing to do with fixing the fingers themselves. Here's the bottom line, the most important thing to remember. Doctors don't treat nail clubbing. The clubbing is just the messenger. The real mission is to figure out what message it's sending, to find and manage the root condition that's causing it in the first place. And here's the really cool part, the good news in all of this. Nail clubbing isn't necessarily a permanent thing. Not at all. The data we have suggests that when you successfully treat the primary problem, an infection is cured, a disease goes into remission, the clubbing can actually reverse itself. The fingers can go back to normal. It's pretty amazing when you think about it, right? This connection between a tiny, tiny change at the tip of our finger and a potentially huge process happening deep inside our chest. It's such a powerful reminder of how interconnected our bodies are. And it kind of leaves you wondering, what other silent clues might our bodies be showing us right now about our internal health?